Morning, I'm Dr. Joseph. Steven, I'm work at Station for 2 years actually, and we're gonna make a tour of CHM. It's a malnutrition clinic, and we also have a little NICU for helping parents who are in need with their children. So let's start. We are in the NICU. Like you can see, is a little space. We have 6 beds available, and we have 2 incubators for big preemie. Like you can see, we have many bonbons of oxygen because we use a lot of oxygen for neonate. Usually is one of the first cause of the reference for neonate here because the other facility doesn't have oxygen and the baby need oxygen. That is our incubator. Fortunately, we didn't have a big preemie here, but we have 2 preemie, like you can see, and we have also concentrator when the baby doesn't need a big flow of oxygen. We can give some little on concentrator. And we have the belly light. Like you can see, one of our baby is on the belly light, and that help with jaundice, and it really helpful because you must know that jaundice go to the brain, the belly will go to the brain and make those children become incompetent. They usually come here because it's one of the is a facility near them, and they know they will find the care they need for that. Bonjour, morning again. We are here with Sergine Valentin. He's a mother of 15-year-old who got a preemie in our NICU. She's a teenager, like you can see, and her mother and father doesn't have the money to pay the fee of the hospital. So the baby born at home. And pour qui ça vous êtes venu là avec lui? Oui. Why she come here with the baby is because the baby was having had difficult to breathe and making some noise telling that the baby was in pain. So she seemed to be really satisfied with the care that the baby provide. She just said that she doesn't have a baby dress yet, so because she doesn't have the money, but we're gonna do something for that. Okay? So the other part of her story is she doesn't know how the life will be after the discharge, but fortunately the center will provide her with some alimentary kit that will help her continue the breastfeeding and have something to eat to keep going. So when we asked her about school, we got an interesting story about she don't go to school because she always have difficulty to see on the board, and she always have headache, and she go to see a doctor. They say she can go to school because she can learn, but probably she suffers some anemia and needs some glasses to have a better see. That is a girl that will need very much attention and better care for her health also, because she just explained that other children in the fratry, brother and sister, go to school and advance, but she's stuck. When they are in the road searching for somewhere to go, somebody tell them about here, and this person bring them here. So we have a good reputation. So if she didn't find Session, she will just give the baby to somebody. She said she will be very happy if she can keep the baby. Parce que légalement, l'autre n'a pas la continuation sur base. Il est fait pas.
Can you explain what you just said to her?
I just talk about that there was another person who just tried at the beginning of the pregnancy who tried to help the this woman. This woman reclaimed the baby to be his own now. She doesn't want to give the baby because she gave birth to this baby, and that person tell that they need to pay a 50,000 good if she want to keep his baby. I just tell that that is illegal, and she don't have to sell the baby. That is against the law. That person just tried to rob the baby. Like you can see, I'm supposed to be a doctor who just say take this medication, don't do that for the good of the baby, but have also to give a lot of explanation, a lot of intel about other things in life, because we have a population who doesn't know very well the law, who doesn't know very well what they can do, what they cannot do. So it's like I'm a social service worker also. So when she come here, she was afraid that she could lose the baby, but she said she found medication. Mamba, when the baby was come there, she was not playing, not sitting, and now, in the name of the God, is sitting and start to play. She doesn't need to be afraid, and she saw the result now. The children start to improve. These children come with diarrhea, vomiting, fever, and also malnutrition. But actually, and we start medication, and right now we have no diarrhea, no fever. So we just talk about she must continue to give Mamba like she did actually, because baby gaining weight each day. So hopefully I think next Friday it can be discharged. I just told the mother to don't freak me out, give the Mamba. She's not the mother of the baby, so she cannot give the. I know this baby. I know well this baby. This baby is here since 2 weeks. He's a 3 months baby who come with severe denutrition, so malnutrition also. So and he got a bad diarrhea. We treat the diarrhea. Now we keeping him for gaining weight, and the weight improve. I got hope that next week Friday also it will be one of our discharge. But when we discharge him, he will go on our formula program, because he came that state because he doesn't have the good food for his age. So we will provide formula to help the baby keep going on until 8 months. We receive more malnutrition admission than before. It's because we just do discharge yesterday that we have some empty bed. So before till Monday, I think we will be full again during the weekend, because we have many children coming the weekend, and Monday usually we find many admission cases. The problem actually we face now, when we didn't have place where to send the other children, and is why the work of CHM is really important, because we help those who are really in need, and unfortunately this number continue to raise again and again. So if you can do something to help us help other people, just do it. Be like Jesus, serve people. Like you see, you already have a quick tour of the CHM clinic, and you probably have a good idea of what we do, what kind of people we help. You hear their story. You probably doesn't know that there's so much pain in the country, but it's what we face each day, and we will be glad that you help us continue to help other people. It's really important for us, and it's not a money waste. It's a save life.